programs fit together. They can aid in successful management of the claim. And really, these programs not only support the injured worker, but they can benefit the employer too. So, with that all said, let's go ahead and get started talking about the initial work injury process. Too many times, we find that employers do not have a thorough, well communicated work injury process in place, which can honestly be scary. It can ultimately be a recipe for disaster. Ironically, I received a phone call this morning from a policyholder who was new to her role. They had a work injury. She didn't know what to do. She didn't know where to send the injured worker. She didn't know how to report the claim. So, we're going to spend some time talking about how you can be best prepared to handle a work injury. Success favors the prepared. So, be prepared, be proactive. So, you don't have to be reactive in the stressful moments following a work injury. Take a minute to think about your company or who you support. When a work injury occurs, do you know what to do, where to go, how to report it, and then how to successfully get that recovering worker back to work? Think about your people leaders, your project managers, your employees. Are they aware of your work injury process? How and when are they informed of your company's expectations for returning to work? I really hope you're not answering that question with, once a workplace injury happens. By having a plan in place, I can tell you your team members will feel well informed, they will feel valued, and you, as the employer, you can have peace of mind in knowing that you have a process in place to retain resiliency and productivity. So, have conversations about your company's work injury process, which also includes return to work, from the very beginning. So, let's start at the very beginning. Have a work injury plan and communicate it. It starts with identifying a company contact or maybe even a couple of company contacts. These are the people who know what to do when a work injury happens. They can answer questions about the work injury. They're responsible for ultimately reporting and handling the work injury. Think of them as your go-to person, your resident expert when it comes to the work injury process. Identify a preferred medical clinic for work injury care. Obviously, occupational medicine clinics are most preferred. Those clinics deal with workplace injuries all day, every day. They are well versed in the work comp process. I understand that an occupational medicine clinic may not be logistically feasible for all of you, but regardless, find a clinic, a health clinic, an occupational medicine clinic, a provider, an urgent care clinic, and build a great relationship with that clinic or with the providers within that clinic. Make sure you take time to educate your providers about your industry, your company's culture, any special instructions when it comes to the handling of a workplace injury, and make sure they know your commitment to return to work. Ensure that they know your company's expectations and do this before a work injury even happens, and then again once after an injury happens. Collect or establish work injury forms, including the state-specific first report of injury, any supervisor investigation forms, authorization forms. Maybe your company requires you to complete an accident form. Make sure you have all of these forms readily available and make sure that they're the most current forms that you have on file, the most current first report of injury. Once an injury happens, that is not the time to be finding out what forms you need or what paperwork you have to turn in. Make sure you have all of these forms readily available so you're prepared. Communicate your work injury process. Don't keep it a secret. Make sure everybody knows what to do and where to go. And it's going to be best if you communicate this and get everybody on the same page from day one. We encourage you to partner with your workers' compensation carrier. They may be able to assist with creating a plan. they may have a dedicated team. EMC, we're lucky we have a dedicated team to help with these processes. They probably have, the most current state-specific first report of injuries, or they have the reporting instructions that you're going to need. They likely have connections with PPO networks. So if you aren't familiar with clinics in your area that handle workplace injuries, they can do a PPO network search and find clinics near your location. Lean on your carrier, not only for their coverage, but also for their knowledge and their expertise too. Let's take a moment and talk about nurse triage. I wish we were in the same room so I could get a sense of who is currently using nurse triage as part of their work injury process. If you have the opportunity to implement nurse triage as part of your work injury process, I 100% encourage you to do so. This can really be a game changer. Most triage partners offer 24-hour, 7-day-a-week work injury nurse guidance for injured workers. This is 24/7 access to a registered nurse. It allows injured workers to speak with a registered nurse immediately following a workplace injury. Nurse triage is typically offered through a third-party nurse triage vendor. We at EMC, we utilize MedCore. They're based out of Illinois, but they have, nurses scattered throughout the country. They've been in the triage industry for over 40 years, but there are several other great vendors in the triage space. So let's talk about why nurse triage is valuable. It improves an often unfamiliar process. Work injuries don't happen daily, or at least we hope they don't happen daily. So nurse triage can simplify and streamline the work injury process. It helps ensure that injured worker is being guided to the appropriate level of medical care. There is the potential for significant cost savings, which we'll talk about here in the next few slides. But let's take a moment to talk about how nurse triage works. I'm going to give a high-level overview of how our triage program is set up with MedCore, but please know that there are some integrations and options that not all carriers or vendors may offer, and I'll be sure to make note of those as we go through. But basically, once there is a work injury, that injured worker should notify their employer of their workplace injury, and then go ahead and call the nurse triage. I do have it noted on the screen that if their supervisor is available, go ahead and make that phone call with the supervisor. I will tell you, we see a lot of phone calls come in where it's just the injured worker calling in, and that's okay. Obviously, the service is 24/7. The supervisor may not be with the injured worker at all times. The supervisor may not be available, and that's okay. If the supervisor is available to make that phone call with the injured worker, they're basically going to provide, your company name and your location. And then they'll hand the phone to that injured worker for the triage assessment. If that supervisor is still available at the end of the phone call, the nurse triage partner will likely talk to the supervisor and just give them an overview and the outcome of how that call went. Basically, the injured worker is going to provide injury details, and based on that information, the nurse is going to provide guidance on the appropriate level of medical care. We typically see two outcomes. Minor work injuries, the nurse will recommend self-treatment. Self-care instructions can be emailed to the injured worker by the registered nurse. We do recommend that our policyholders report all injuries, regardless of how small. This helps track any near misses or loss prevention opportunities to prevent an even bigger injury from happening in the future. I always like to share the story of a policyholder. We had seen multiple reports come in for smashed fingers. Nothing that was too terrible. They resulted in self-care. But after about the fourth report where the workers had smashed fingers, that policyholder was able to evaluate what's going on, what's causing these smashed fingers. They did determine that it was a faulty latch on a cooler, so they could go ahead and fix that latch on that cooler, again, preventing maybe an even bigger injury from happening. So we do recommend that all injuries are reported regardless of how small. Our claims colleagues, and probably some of you can attest to sometimes those small work injuries turn out to be the big ones. The great thing about self-care outcomes is the cost savings. These are incident only, report only claims. They're $0 claims. So if there's no lost time and no medical payment, it is not impacting your claims experience or your mod factor. The other recommendation we do see, if it's something more significant than a self-treatment outcome, is a referral for medical care. The nurse triage partner can provide that injured worker with your preferred clinic so they can be guided to that clinic following their work injury. Like I mentioned earlier, it's great to have a clinic identified. So again, your nurse triage partner can provide that clinic information to the injured worker. Most triage partners have the opportunity to also elect to use a directory, and this is just really a database of the clinics. So if you have an employee who is traveling or working from home, or you have a very mobile workforce, Nurse Triage Partner can find a clinic within their directory that is near the injured worker at the time of the injury. In addition to clinic guidance, that nurse triage partner is also going to provide a recommendation on the time frame for seeking the medical care. And this is usually within a couple hours, within a day, or within a few days. So what happens following the call with nurse triage? That nurse is going to complete an incident and triage report. And this includes information like what was the date and time of the phone call, what was the date and time of the injury, what was the nurse's recommendation, what was the injured worker's decision, and then just a brief summary of what the injury was and what the outcome was. We do have our nurse triage partner pre-fill the state-specific first report of injury, and they send both the incident report and the first report of injury to the designated work comp contact. Remember earlier I said have a designated work comp contact. So those reports are being sent to the contact and then also to us at EMC. And again, some carriers have this reporting component integrated, some do not. I will tell you, and we'll talk about it in a few slides, the benefit of having this reporting component built in. If they do not have the reporting component built in most cases, the triage partner would let the injured worker know if you decide to seek medical care, make sure you report it to your employer and they report it to their carrier. The way we have the first report of injury and the reporting component built in, they have been program differentiators for us because as long as a phone call has been made to our nurse triage partner, we are finding out about the work injury so they can get off on the right foot from the very beginning. Again, this all helps with simplifying and streamlining the work injury process. We know employers are busy. They are wearing many hats. They are juggling many balls. So if we can take an unfamiliar or maybe an infrequent process and streamline it, it becomes a win-win for everyone. So let's talk about some more benefits of nurse triage. It is a 24-hour, 7-day-a-week, 365 days a year access to a registered nurse. It relieves supervisors from making medical decisions that they're probably not qualified to make. So this is a big deal. Again, it's taking pressure off of supervisors from making medical decisions. Too often we can see that a supervisor may, rightfully so, err on the side of caution. They don't know what to do or where to send the injured worker, so they're going to send them off to the nearest location. It may be an emergency room. We know what happens when they go to the emergency room. They sit, they wait, the cost of the claim goes up. Now, obviously, if an injured worker needs to be at the emergency room, that's where they should go. But the nice thing about having nurse triage as part of your work injury process is you do have a registered nurse there to provide that guidance and relieve supervisors from making medical decisions. It ensures injured workers receive the care that they need so they can return to work safely and timely. It reduces medical only and lost time claims and expenses by avoiding unnecessary office and emergency room visits. I talked earlier about the self-treatment outcomes. Nearly 40% of our calls result in self-care, and that employee can return to work without initial medical care. In addition, on average, our nurse triage claims are experiencing a $1,700 per claim savings. These are savings that the policyholders get to benefit from or that the employer gets to benefit from. The reporting component improves timeliness of injury and claim reporting. Like I mentioned, we have that integration built in. Last year, we had just over 9,000 injuries reported through nurse triage. Nearly 90% of those claims were reported within 3 days. And more impressively, 77% were reported within 24 hours. Translators are often available. I know MedCore has several different, I think over 200 different languages and dialects. They have bilingual nurses. So this is something that may be a benefit to you. Calls are recorded. So if there's ever any question, concerns, or quality assurance, we can go ahead and pull that call recording. I always tell our employers, our policyholders, that if you have an injured worker call into our nurse triage partner and they come back and tell you that the nurse said to take the rest of the week off work, please don't believe them. Actually, please call me and I want to pull that call recording because that is not the role of nurse triage. Nurse triage is to initially evaluate that work injury and provide a recommendation on the appropriate level of medical care. It is up to your carrier to investigate, to determine compensability. It is up to the healthcare provider to take them off work if need be. Your nurse triage partner should never be taking them off work and making that decision. And I've probably said it 4 times already. It simplifies and streamlines the work injury process. It takes the guesswork out of what to do. So implementing nurse triage has really been a game changer for EMC and for our employers who are using it. I strongly encourage you to explore this option if it's available. If your carrier does not offer nurse triage, you as an employer, you can partner directly with triage vendors. So again, if your carrier doesn't offer it, go ahead, seek out a direct partnership. It has brought a lot of value to the work injury process for our employers and policyholders. So post-injury, now what? Let's shift and talk about return to work programs. Having a return to work program is just as important as accident prevention. And as I mentioned earlier, it's important to talk about return to work before an injury even happens. So a return to work program is designed to bring injured employees back to work safely, timely, and in a medically approved capacity. It offers temporary transitional work that aligns with that injured worker's medical restrictions while they're recovering from their workplace injury. Think about your company. Do you have a return to work program in place? If you do, that's awesome. When is the last time it was reviewed or updated? It's a great idea to review them annually. Maybe information has changed, maybe information needs to be updated, but kudos to you if you have a return to work program in place. You are at least one step ahead in being prepared. I challenge you to have your return to work program shift the focus from disability to ability and really concentrate on what the recovering worker can do versus what they can't do. Too many times, all the injured worker hears is that they can't do this, they can't do that, they can't do this. So really concentrate and focus on their capability. What can they do? Did you know organizations with a return to work program are 40% more likely to return injured employees than organizations without a program? Remember earlier I said success favors the prepared. This is being prepared. Early return to work programs save companies 35% on medical costs and 30% on lost time days. The longer a recovering employee is off work, the tougher it becomes to get them back. And you may have experienced this. Let's take a look at some stats. If a recovering worker is off work for up to 4 weeks, there's a pretty good chance you're going to get them back. There's a 90% chance of returning to work. If they're off work for 6 months, you have a 50-50 chance of getting that injured worker back to work. Take them out of the workplace for an entire year, there is a 5% chance. Good luck. Oftentimes, depression, lack of motivation, they are seen in workers who are out of the workplace for an extended period of time. It makes it that much harder to get them back to work. At EMC, we help create return to work programs that consist of two valuable components, a policy statement and a transitional work list. The policy statement outlines the purpose of the program. This is your commitment to make every reasonable effort to provide suitable temporary employment to an employee who can't perform his or her job because of a workplace injury. Transitional work allows an employee with temporary restrictions to work in a modified or an alternative capacity while they recover. And this can include, a modification to the employee's original position or maybe providing an alternative position. It really depends on the medical restrictions that they've been given. We do encourage you to have corporate counsel review your return to work program as part of your company's best practice. So what do some return to work options look like? There may be times when an injured worker cannot return to work in their normal job or their normal work capacity. And so we really encourage you to find modified work or alternate work. Can they return to work in their same position but with modified hours? Can they return to work in their same position, but maybe with a modified workstation or modified duties that align with the physician's restrictions and are within the physician's approval? If these aren't options, consider having the recovering employee use transferable skills to perform a different job, or even maybe learn new skills and perform that different job. Be creative. Think of special projects that you've maybe been wanting to work on. Do you have any forms or safety training manuals, housekeeping, inventory, organizational tasks, something? Be creative. Find some way, if at all possible, to keep that recovering employee engaged and in the habit of coming to work. So why are return to work programs valuable? I've already talked a little bit about it a few slides ago, but let's dive in a little bit deeper to program benefits, return to work program benefits. They help control workers' compensation costs. Obviously, something that is important to all employers and business owners. Returning injured workers can reduce expenses in a number of ways. Lost time wages, hiring replacement workers, turnover, time, effort, energy, timing, the list can go on. It decreases workers' compensation premiums. It reduces lost time claims and payments, which can improve the overall experience modification factor. Without getting too far in the weeds, your modification factor is used as part of the calculation in figuring your work comp premium, essentially what you pay for your work comp insurance. So if you keep your losses and your expenses low, your work comp premium will also be low. It builds constructive relationships. A positive, comprehensive, well-communicated work injury process fosters better relationships between employers and their employees. I said this earlier, when employees feel supported, it fosters a sense of belonging and teamwork. They're less likely to abuse the system. I can tell you an unhappy, unsupported, uncared for, disgruntled worker can really wreak havoc within a company. On the flip side, when they do feel supported, they stay connected to work. This can support engagement, it can improve their healing, and it can really have a significant impact on whether or not the employee returns to work. By being prepared and communicating your return to work plan, you can proactively address and really probably alleviate some fear. Injured employees, they often fear the unknown. This is likely the first time they've been injured. Their life has been disrupted. They are probably dealing with so many different emotions, questions, unknowns, uncertainties. A consistent routine and clear communication can help alleviate this fear. Again, team members will feel well informed and valued as long as they've been well communicated. And you can have peace of mind in knowing that you have a thorough and thoughtful return to work process in place. A return to work program can help dispel misconceptions. A well communicated program helps employees understand workers' compensation, it's not a paid vacation. It is a safety net during challenging times. So make sure you communicate that to your employees. Communicate it early and often. It minimizes litigation risk. By maintaining open communication and addressing concerns promptly, you can reduce the likelihood of costly legal battles. Make sure you offer employees reasonable opportunities to return to work. You can demonstrate your commitment to supporting them and their recovery. Demonstrate good faith. You want to help them get back to work. Don't let them get comfortable sitting at home. I think we all know, what commercials they're running during the day when these injured workers sit at home. So get them in the habit of staying at work and supporting their recovery. I want to take a moment and touch on a couple more components that can help when it comes to cost containment. Nurse case management is one of them. Nurse case management is a collaborative process where a registered nurse coordinates and basically oversees the medical care of the injured worker. The goal of nurse case management is to ensure effective treatment, help contain costs, and promote a timely return to work. Nurse case managers typically serve as liaisons among injured workers, the medical providers, the employers, and the carrier, and their focus is really to ensure that all parties are aligned on the medical care and goals. A nurse case manager's role involves several key responsibilities aimed at ensuring that all aspects are well coordinated. All care aspects are well coordinated. They evaluate the injured worker's condition, their care plan, and their progress. They identify any barriers to recovery or even returning to work. They monitor outcomes, ensure compliance, and advocate for care. They maintain detailed records. They ensure adherence to laws, and then they also follow best practices and billing guidelines. Obviously, each claim is very different and all claims are unique, but it's important to be aware of some common nurse case management triggers. Indicators can vary, but some revolve around, prolonged treatment with minimal improvement, no progress in the claim, complex or complicated injuries, communication barriers, unclear medical direction, and non-compliance with treatment or even malingering. And keep in mind, nurse case management can be assigned on a task-based level, typically referred to as a task assignment, or full or field case management. A task assignment may be used for something relatively like one time in nature, whereas field case management is typically for a longer duration. Telephonic nurse case management, or TCM, is actually growing in popularity. And so this is where nurse case management services are provided telephonically or remote over the phone. It can be most cost effective when appropriately used. So TCM probably is not going to be used on more complex cases where in-person oversight is most beneficial, unless there are some extenuating circumstances where TCM can be used. So what are some benefits of nurse case management? It improves medical outcomes and recovery. Nurse case managers can lead to overall better outcomes by ensuring the injured worker's medical care is comprehensive and well coordinated. It reduces claims cost and unnecessary treatment. This efficient coordination of care can reduce costs by preventing duplication of services, and sometimes they can even prevent unnecessary care. It enhances communication and collaboration. Nurse case managers, they advocate for the patient's needs and preferences, and they do their best to ensure that they receive the best care possible and as much support as they need. Speaking of support, they support a safe and structured return to work plan. Nurse case managers provide injured workers and their families with education, information, guidance, and support regarding managing their injury, their treatment plan, and their return to work timelines. Pharmacy benefit managers, or PBMs, is the final component I want to spend a few minutes covering today. PBMs are partners that manage prescription drug benefits for carriers, larger employers, or other payers, and they're responsible for a wide range of services. They're designed to optimize the delivery and cost of pharmaceutical care. So, when an injured worker fills a prescription, the PBM processes the claim. This includes verifying patient eligibility, applying the appropriate formulary, and ensuring that that pharmacy is paid for their medication. PBMs act as a liaison between insurance companies, manufacturers, providers, and pharmacies. They negotiate drug prices. They create and manage formularies. They ensure injured workers receive appropriate medications for their recovery. They process and pay prescription claims, and they manage pharmacy networks and drug utilization. So let's take a look at some of the benefits of PBMs. Obviously, cost containment. One of the primary goals of PBMs is to contain the cost of prescription drugs. So they negotiate discounts, they manage formularies, they implement utilization management programs. All of this can help reduce the overall spend on medications. They improve claim outcomes and adherence. They ensure that patients receive effective and appropriate treatment at the best possible cost. They really can help drive recovery. Regulatory and clinical oversight. Clinical oversight of PBMs involves monitoring their impact on patient care and medication adherence. This oversight ensures that PBM's decisions regarding drug formularies and coverage really align with the clinical guidelines and the best practices. Operational efficiencies relates to the importance of timely claim handling and processing and payment that I mentioned earlier. And then probably very, very important to all of you, injured worker safety. PBMs and other integrated programs help ensure prescriptions are clinically safe, they're medically necessary, and they are cost effective. So I know we just covered a lot of content in a short amount of time, but I hope you were able to take away some key points to help ensure you are well prepared when it comes to the work injury process. Like I mentioned, be prepared, be proactive. Success favors the prepared. Don't wait until an injury happens to start thinking about these programs or these processes. Be prepared now. Communicate early and often. Like most aspects of life, communication is key, and communication can go a long way. So communicate early and often. Implement programs that make a difference. Evaluate opportunities for improvement or maybe even changes that could really impact your process and your outcomes for the better, not only for the injured worker, but for you, the employer, as well. I want to thank you again for joining today's webinar. Please feel free to make use of EMC's resources. We are a company that believes in keeping insurance human. We want to be helpful. We want to be supportive. Our website has so many great free resources. So feel free to scan the QR code, take advantage of this information. These resources on our website are accessible to anyone. Like I mentioned earlier, we do have a dedicated team to assist our policyholders with developing a work injury process. That includes nurse triage, return to work, case management, and PBMs. So if you happen to be an EMC policyholder, please let me know how we can support you. If you're not an EMC policyholder, that's okay. Check with your carrier, see what resources they offer, just to make sure that you have a robust work injury program from beginning to end. They likely have resources available to support you. I am happy to go ahead and open it up for any questions or comments that have come in. So I'll turn it back over to Nicole or Levi if there's any questions that I can help answer.
Thank you so much, Alyssa. Appreciate your expertise a lot in leading this webinar. And thank you, of course, to EMC as well for the longtime partnership with ABI. As Alyssa mentioned, yeah, I don't think I see any questions right now in the chat. If anybody has a question, you can feel free to hop off mute quick, or of course, you can feel free to throw something in the chat. I see a couple of thank yous to Alyssa from folks in attendance. Give it a minute in case anybody has a question.
That sounds good. And my contact information is on the screen. So if you take this information back to your desk or back to your workplace and have any follow-up questions, please don't hesitate to reach out to me. I'm happy to be of help.
I guess, wow, real quick, I will just share. So this is part of a webinar series, of course. And so everyone in attendance knows the next one will be taking place September 16th. It'll be on Iowa's shifting workforce demographics and potential impacts on our workers' compensation expenses and case law update. That will be led by Brown Winnick. It'll be at the same time as this one was, 11:15 to noon. The final of the series will be How to Survive an OSHA Inspection on November 4th. That'll be led by our friends at Assured Partners. And then we also have a webinar next week, not tied to this series, that is free to attend. Will be taking place on July 15th at 11:30, and it's going to be on Iowa's trade and foreign investment landscape. So if there's any interest in that, all those details are on our website, or of course, you can always reach out to me. I still do not see any questions, so I think we're good to wrap it up and give everybody just a few minutes back. Alyssa, thank you again. Appreciate your time a lot, and thank you to everybody who hopped on today.
You bet. Thanks again for organizing it.